It is my pleasure at this time to introduce our moderator this evening, Marilee Orsini. Marilee has earned a reputation for being one of the nation's most knowledgeable experts on home care. She has literally been working in the home care industry and with home care agencies for nearly 30 years. And aside from her personal involvement in the industry as a business owner and as a consultant, she is also very involved in numerous organizations throughout the country that have to do with home care. It is now my pleasure to turn over our presentation to our moderator, Marilee Orsini.
Thank you so much, Tom. And thank you so much, everyone who is joining us tonight for this topic on caring for someone with Alzheimer's at home. You know, there are about 5.3 million people who have Alzheimer's disease, and over 11 million people who, it's estimated, are providing unpaid care as family members to their loved ones with Alzheimer's disease. November is National Family Caregivers Month, and it also is National Alzheimer's Disease Awareness Month. So to sort of take advantage of those monthly commemorations for this terrible disease, the National Private Duty Association is hosting this conference. The National Private Duty Association is a trade association that has membership of agencies who do provide care to people in homes. And these agencies employ all their caregivers, and many of those are trained specifically in Alzheimer's disease. So we thank them for doing that as a public service tonight. We have two speakers that are highly qualified to talk to you tonight about Alzheimer's disease. Our first is Rick Cavanaugh, and he's a master's in social work, and he also is a certified dementia care practitioner. He is Director of Staff Development of Easy Living in Clearwater, Florida, and has over 35 years of experience in healthcare, and many of these years spent dealing with patients who have Alzheimer's disease, families, and issues surrounding the disease. Our other presenter is Chuck Bailey, who is president of Bright Star Franchising in the Chicagoland area. And he's responsible for the company's life care staffing franchise system. And he daily works with families in developing care plans and selecting home care businesses, and developing care plans and selecting home care assistants for people. And they're currently caring for about 1,000 patients a week who have Alzheimer's disease. And tonight's topics are specifically going to cover the overview first of caring for someone with Alzheimer's, the medical and psychiatric evaluation, care assessments, the family meeting, hiring trained private duty staff, and then some resources. So, Rick, would you like to start our presentation tonight, please?
Sure, be glad to. Thank you very much, Marilee, and welcome to all of you folks who are listening and watching. I guess the biggest message I want to give to all of you at this point is that you're not alone. You know, as Marilee indicated, Alzheimer's is a disease, or at least a group of symptoms, if you will, that affects a lot of people in our country and throughout the world. And there are a lot of unpaid caregivers that are involved in providing care, and these can be, you know, spouses and significant others and children, whatever, neighbors, friends, and do reach out to them and get some assistance because it is a very significant issue, and it can be a challenge on occasion, yet on the other hand, it need not necessarily be a negative thing for your family. So what I'd like to do is just talk through some of these issues and you know, give you some advice and counsel, if you will, on how to best handle these things. Probably the most important thing I would stress to everyone is that Alzheimer's is a progressive disease. It is, you know, a dementia that continues. It is not, you're not going to be able to cure it. The medications that are available might be able to provide some clarity of thinking along the way, but you're not going to be able to reverse it at this point in time. I hope in the future that would be different, but at this point that's exactly what we're talking about. So since it's a progressive disease, you should be aware of the fact that, you know, your loved one who has been diagnosed with this condition may well go through a number of phases, if you will, and you can read lots in the literature about how you want to label this and whatever, but from a simple standpoint, I just like to look at it from maybe a three-stage progression, and that is the first stage is one of forgetfulness. we all need to differentiate between normal aging and Alzheimer's. Be very candid, I'm in my 60s and I have my senior moments, and many of you listening have your senior moments. The difference is that I recognize the fact that I just can't remember what that is. I can't remember that person's name. The person with Alzheimer's very frequently does not recognize that they are being forgetful, or they will be very, very upset about that, even going through a depression about it, and they will frequently blame the caregiver. Honey, why did you put my keys there? And Alzheimer's Association always talks about finding the car keys in the refrigerator freezer. Why is it there? Well, you put them there. That's difficult, but they're forgetful about that. And they'll also sometimes become somewhat argumentative. One rule of thumb I would hope that all of you embrace is the fact that you will never, ever win a fight with someone with dementia. Go with where they're at. Because they're not able to think as clearly as they used to. And that's going to be difficult for you because you remember them when they used to be better. They might have been a very scholarly person. They might have been great at mechanics. They might have been great at art, whatever it is. But now they're not that type of person. And so you're seeing that personality change. So forgetfulness is a big issue, and that becomes, a major issue in terms of, those who are driving. Do you take the car keys away? How do you deal with all that? My wife and I cared for her elderly grandfather for some time, and it was very interesting. He had a girlfriend, and he could drive amazingly well, but he had no idea where he was going. So he got a girlfriend who could navigate, and believe it or not, for a while they succeeded until one day she got them lost. And then we had a major problem. So those are the kinds of things, in that first stage that can happen and moving into the second one. And that second stage is abject confusion in many cases. They don't know perhaps day from night. They get things mixed up. They forget names. They don't remember who they were. Because again, with Alzheimer's, folks may remember stuff from the past. They'll remember something about when Glenn Miller came through town on a band, and on a train or something in their small town, but they can't remember what they had for breakfast. That's the reality of that second confusional, if you will, stage. And the last stage is one where you have literally you are beginning to progress towards a point of death, to be very candid. And some people are somewhat surprised when you find out that you actually can ultimately die from Alzheimer's. And at that point in time, you on occasion may have someone who's quite aggressive. Not always, and that's the important thing. Everybody's different. You can't predict. We all would like to have some great roadmap would tell us exactly what it's going to be like, and we'll know when we exactly get through stage 1, stage 2, stage 3. It doesn't work that way. You just kind of have to roll with the punches and get a good feel for all of that. So, in terms of caring for someone with Alzheimer's, there's lots of reasons to keep them at home. Number one, cost. It is much less expensive than having them put into an assisted living or a nursing facility. They have the element of familiarity with where they're at, and they're very comfortable with that. And they have, great things, the memories, the pictures on the wall, the sofa that smells the way it has always smelled, whatever it is. And, of course, having their pets around them, that sort of thing. And you want to avoid, hopefully in many cases what sometimes gets called relocation trauma, which is a fancy academic way of saying it kind of spooks somebody when they're having to go into an unfamiliar environment. Your primary goal in terms of working with someone at home is to make them as calm as possible. The goal, we stress this with all of our caregivers, is to just keep someone calm, keep them happy. Provide as much stimulation as they can handle, but don't overdo it, and make sure that everybody finds a good balance within the family home situation. And as far as how you make it work, again, stay calm. Keep things simple. The KISS principle, keep it simple. Don't use complex language. Just very simple. Sit here, do this, do that. It's much easier than having lengthy statements that, frankly, many folks with Alzheimer's just will not understand. Also, in terms of staying there, get a good assistance from other folks, and know your limits in terms of what you can do personally, which then gets to the medical and psychiatric evaluation. You need to have a good assessment of your loved one. Literally 9-10 months ago, many people were still arguing it's really hard to diagnose Alzheimer's. We don't know where we can do that. Well, the fact of the matter is there are now recent advances using MRI and spinal taps and all kinds of things that neurologists and geropsychiatrists are able to come up with a much more specific diagnosis. I know you love your family practitioner, and I love mine too, but you may need some additional expertise in terms of getting an accurate diagnosis. Because the fact of the matter is, not everyone with dementia has Alzheimer's. They may have many other types of conditions. So you want to make sure that if indeed it is Alzheimer's, you can treat them and deal with them from an Alzheimer's perspective. If it's something else, there might be actually a treatment for that. And the other thing, again, that I would definitely stress is this ongoing assessment. How they are today, will be different than it is a year from now, 2 years from now. The disease can run anywhere from 2 years to 20 years. So, things will change, and you need to have an ongoing assessment of that process so that you can understand exactly where your loved one is at, and then modify your strategies, modify your ways of dealing with them to cope with that. And then finally, looking in terms of your care assessment, like I said, you need to constantly monitor this also. Look at their behavior. What's changing? Maybe they've gone from this forgetfulness stage to being more confused. Maybe now that you're beginning to have some concerns about them wandering off, and that can happen. Just remember, when they're wandering off, that behavior usually is purposeful. You may not understand it. They may be walking down the road. They think they're going to Aunt Sally's farm to go get some apple cider, and that's fine. But it doesn't happen to be fall, and it doesn't happen to be apple cider. But in their mind, that's what they're doing. And you need to learn to redirect them so that they don't walk off and endanger themselves. And those of you, especially in northern climates, where I've spent a number of years myself before moving to Florida, in the wintertime you have to be very careful because people can wander off and, of course, die due to the cold. Do address the level of care that they need. Understand exactly what it is that needs to be provided, whether you can do it, whether you can get folks from the community, neighbors, friends, church members, whatever to help, and make sure that they're all understanding of what's going on. It's one thing to have experience, quote unquote, with dealing with someone with Alzheimer's. It's another thing to have someone who's really trained at dealing with that. And I know Chuck's going to talk about this, but the Alzheimer's Association and many other groups can provide tremendous help on that. And get this understanding throughout the family. It is definitely a key issue, and because I see this all the time, where we have people that I refer to it as sandbox fights, just like we used to have when we were little kids. We're throwing sand at our sister or brother and all that. Or we have these family feuds and all this kind of stuff that comes up at Thanksgiving time with the holidays coming up. That kind of comes up. But when you've got 4 or 5 siblings and other aunts and relatives, and they all think they know what's best for mom or dad, you've got to get everybody on the same page. And the last thing you want is to have a sandbox fight that now has people who are in their 50s and 60s and 70s, but still at least, not physically, but, having that whole concept of throwing sand at each other. And so, that's all important that you get together, get on the same page, and then all of these other issues that can impact the situation, of course, can include finances, can include where they're living. Do they need to move in with someone else? Do you need to move in with them? We have here in Florida a lot of cases where someone has retired down here. They've lived here for 20, 30 years. The family's back up in Philadelphia, say, and they'd like them to move back. Well, the mom doesn't want to move back to the snow. Well, how do you provide that care and have mom still stay in Florida? The driving issue is a big one. Finances, making sure bills are paid, making sure they're eating well. All of those types of things, especially if it's long distance, become very, very much a challenge. So at that point, I'd like to just turn this over to Chuck, and he can move on and talk a little bit more in terms of some of these family meeting issues and so forth.
Great, thanks, Rick. Appreciate that information. As Rick said early on, and Marilee stated the statistics of Alzheimer's, you are not alone, to quote Rick. And I can tell you that at Bright Star we have 184 offices across the United States. And I know, and having been an owner and operator and worked directly with hundreds of families dealing with Alzheimer's, is when that phone call comes in to one of our offices, it's one of the toughest phone calls for us to take, because it's a point where the family feels almost like that they're at the end of the rope and they've given up, and that they have to go outside the family network to try to seek additional help. The one word of advice, in addition to what Rick said again about not being alone, is that we share with folks is it's going to be okay. Unfortunately, this is a progressive disease, but it lasts many years. And what I've seen is the disease devastate the loved one, but in fact be in a situation where it may even devastate the family even more. So that's what the big thing that I like to coach folks on is really understand the disease. Not only what Rick has said about the progressive stages of the disease, but also the impact on family members at various stages. And later on we'll talk about some of the educational resources and opportunities that are out there. I think, though, there's some things about dementia, as was discussed earlier. Alzheimer's is a form of dementia, but dementia is a series of symptoms that can be acute in nature when it's not directly related to the Alzheimer's disease. The example that we see quite often is that a family member or loved one may be living alone. Perhaps they are not getting as much stimulation as what they normally would have gotten. Maybe they are hospitalized for something as to you and I might be as simple as a urinary tract infection, but it's progressed to the stage where it is requiring hospitalization. It is not unusual to see dementia-type symptoms exhibited among these family members, and one often jumps to the conclusion that you may be in the middle of a progressive state. And this is where it's important to really seek out your neurologist, seek out your family physician, and see if indeed with a change of environment, change of behavior, change of medical condition improves the symptoms there, and your doctor or your loved one's doctor can really help out. When you've ruled out that it is an acute situation along with your doctor in understanding the progressive states of the disease, it is important to go in and really meet as a family and discuss several things. Number one is the level of care required. Oftentimes we are called in to a family situation after a very unfortunate event. Perhaps a loved one goes out and leaves the home, wanders, gets lost, it's cold out, and they really put their life at risk. It could be another situation where they're cooking and leave the stove on and the home fills up with gas and even a fire occurs. We see all of these things. So one of the things that's important to understand is what is the level of care that's required for your loved one, and then what level of support can the family members give? Can mom or dad be left alone at certain hours during the day? And what's that going to cost us if indeed we have to take time off our jobs or in fact bring in a caregiving agency to support the schedules when we're not able to be there? One of the big things is to make sure that all the siblings and relatives agree. As Rick said earlier, this is the worst time to have a sandbox fight because we understand heart attacks, we understand cancer, we understand other diseases, but this is the one that is the most confusing for families because they just want mom or dad to be themselves again because they might otherwise look extremely healthy and physically fit, but they're just not themselves, and so the emotions run strong. And one of the things I see quite often happen is family meetings will occur in the evening after work with mom and dad there talking about care, and many of us have heard the term sundowning, and it's late in the day when mom or dad's fatigued, their dementia symptoms are at their highest, and it's easy to be argumentative and disagree with any strategy that might involve some external care and in fact very strong denial. So we oftentimes coach folks to go instead, take an hour or two off work in the morning and go have a breakfast meeting. It is a much better time of the day to have a meeting with the loved one that may be suffering from Alzheimer's and get some concessions about perhaps handing over the paying of the bills or some tasks that are perhaps putting them at risk in the home. So it's a shift the schedule to a better time of the day, and this will really help to avoid conflicts. And then finally, as I mentioned before, seek that professional assistance both from the doctor, but also other resources in the community that have dealt with this before. And in fact, there are any number of agencies in the area, even if you're not seeking care, to supplement your schedules. Call in a couple of agencies and let them give you ideas about how to deal with a family situation. What you can do is really take on a strategy to help minimize the strain on the family. As I mentioned earlier, I've seen this disease tear families apart far more often than any other major debilitating disease, a stroke, or other things that are more chronic in nature that can last for years as well. But because of the emotional part of this, you just want mom or dad to remember, and the reality is, as Rick said, they may remember 25 or 30, 40 years ago, but they may forget to eat breakfast and assume that they did, and this leads to weight loss and things like that. So one of the options that you have to supplement this family caregiving that takes place is to seek out a trained private duty agency or somebody that you know that has specific dementia care experience. And this is one that's important to really understand whether or not that caregiver is properly trained and do they have expertise in dementia care and Alzheimer's. As Rick said earlier, redirecting the patient from perhaps a destructive activity. It's not unusual for aggressive behavior or verbal or even physical abuse to occur, and in some cases even sexually aggressive at any age. And we see this quite often. So somebody skilled in redirecting those behaviors, encouraging the interactivity between the caregiver and the other family members, and really maintaining the general well-being and health of your family member, because it is very, very common for dementia patients to lose weight because they're not eating properly. Again, take on perhaps other illnesses, and I mentioned urinary tract infections earlier, because personal hygiene also becomes an issue for the simple reason maybe the loved one forgot to take a shower, which is perfectly understandable in the certain states of the disease, or I've seen cases where somebody's just absolutely physically active, they're very verbal, but they forget how to use soap. They forget how to take a shower and don't know what that event really is. Clothing that becomes soiled and is worn on a repeated basis. So a trained caregiver with expertise, either through an agency or through somebody that you know, will definitely be able to help you make a difference in your loved one's life. And any of the agencies out there that focus in Alzheimer's care can give you options ranging from simple respite care, if a family or a loved one is living with you, and simply you might need to get away for a weekend or get away for a dinner or go to your son or daughter's soccer game, and mom or dad can't be left alone. Most qualified agencies can bring in a caregiver for just a few hours of intermittent care. And this can be made available on an on-demand basis, or it can be made available even on a scheduled basis. And one of the great things about working with an agency to supplement what the family can schedule is the ability to ramp up hours over time in order to really try to keep some semblance of normalcy to your life. And I just really want to reinforce here before we move to the last slide that this disease, and Marilee is certainly the expert on this, I would say affects the family caregivers as much, if not more so, than any other disease state that I have experience in. And you need to watch for those warning signs and know when to get the family together and perhaps leverage either an outside caregiver from the family or an agency. So moving on to the final part here, There are a wide range of resources available. One of the best out there is the Alzheimer's Association, at www.alz.org. If you go to the website, you can find support groups. You can find there's online reading and PDF files that you can download and share with family members. Also, in most communities, in most major cities in the U.S., there are local chapters of the Alzheimer's organization where you can go in, sit with an expert in the organization, and they can give you material about the disease. They can recommend outside caregiver resources if you need to take that route, and perhaps even put you in contact or recommend a neurologist or doctor if you don't have that resource there. Another website that's available is AlzheimerCaregiversResource.org. This is an online source for information about how, as a caregiver, that you can manage your life a little bit more effectively and try to balance the demands of your loved one, your family, your job, and I guess want to reinforce as much your personal health. This is a disease where I've seen many family members' health suffer because of the emotional toll and the physical strain in dealing with a loved one is. So please recognize in closing here that there is a ton of information available, and that this disease is as much about the entire family as it is about the loved one. And when it circles only around the one getting the care rather than the one giving it, is I think when things start to break down within the family unit. So with that, I think we'll turn it back over to Marilee, and we'll work through a few questions.
Thank you, Chuck, and thank you, Rick. Excellent information tonight. And we have lots of questions coming in from our listeners. So I'm going to combine some of these, and if we don't get to all these tonight, any question you've asked will be answered by email if we don't get to it tonight. But Rick, I'd like to start with you, and I'm going to combine these two that have to do with how do you best redirect behavior, and what are some activities that you could interject in the home to keep the person with Alzheimer's busy.
Well, let me take the second question first. Some of the activities that can be very, very helpful is scrapbooks and picture albums and other things that allow somebody to just talk about what's going on. Pictures of Aunt Frida out there in her barbecue, and oh yeah, we used to have those great parties. Tell me about it. And you get the person to start talking about their experiences from the past, and they may well decide that you're Aunt Frida, and that's okay. Like I said before, just go with it. Yeah, okay, I'm Aunt Frida. Tell me about Aunt Frida, and that can get them talking. Some people do recommend, or at least try, things like flashcards and other things to try and keep them, more mentally alert and aware of some things. But all of those types of things, there's so much you can do in terms of keeping them calm. And when we talk about communication, remember, it's not all verbal. You can touch someone, you can hug, you can caress, massage. Music therapy to keep them calm. Music therapy means play some music that they like. We've got a caregiver that's actually downloaded trailers from movies that one of our clients likes, and so when he gets a little bit aggravated and aggressive, they play these movie trailers. Oh, he's kind of in hog heaven about all of that kind of stuff. So you can do that. So there's just be creative, and if it works, go with it. If it doesn't, do something different. As far as redirecting, that is a skill, but you can develop it. If someone's, if they're just walking down the street and and they're walking away, if you go out and say, Charlie, don't go that way, shouldn't. That's becoming argumentative. You say, Charlie, well, where are you going? Well, can I walk with you? Oh, look over here. Over here. See that rose? Well, let's pick that rose. Let's take that back and put it in a vase. And what you will find with many people is that they will immediately jump to the attention about the rose, and they'll forget that they were walking down and walking away and so forth. It is a skill that you can develop, but you can find that if you're just calm about it and cautiously, calmly say, well, look at this. It's literally called changing the subject. And when you change the subject, you can have an impact on them. Don't force them, don't pull them, don't push them. That's not the way to do it. But just, let's go in this direction instead.
And Marilee, just to add one further comment to that, I mentioned earlier that it's our experience that it's not unusual at all for the Alzheimer's patient in the mid-stages to be even sexually aggressive, and that can be very embarrassing for the family members. And it is a simple redirect, as Rick stated. In fact, at a recent conference that I was speaking at, I polled the audience and I said, by a quick show of hands, tell me in the last 30 days who has had to have a talk with, a family that of a person you were caring for about, their mom or dad's perhaps sexual aggressiveness. And I was amazed that about 70% of the hands in the room went up. And this is kind of the elephant in the room out there, and it's a great opportunity to just simply treat it as something as simple as even redirecting from a behavior that could be harmful, because it really is no different. So don't be afraid to address that.
Very, very good answers. Thank you both. And Chuck, I'm going to come back to you with this one. Does Medicare cover the private care at home for someone with Alzheimer's disease?
Unfortunately, Medicare does not cover it. If an Alzheimer's patient does have some qualified event that has occurred, a hospitalization for the urinary tract infection that I mentioned, or perhaps an injury of some type, then and they're of an age where Medicare is in place, then Medicare is going to cover the care of the acute situations that occurred there. However, it will not cover the continuous care, or sometimes what's referred to as custodial care, of the Alzheimer's patient. So it's been our experience that this cost will come out of pocket from either the family member or perhaps the patient or the estate of the patient. But oftentimes we see a patient will have long-term care insurance. And it's surprising, I would say half of the families that I meet, they don't even know that mom or dad has purchased long-term care insurance 20 years ago, so that would be something good to look into. But your long-term care does indeed cover that. Normally the Blue Crosses of the world, the United Healthcare, those will not cover what's considered custodial care.
Thank you. Rick, I've got a couple of questions about the difference between dementia and Alzheimer's, and what are they, and is it even important to know those differences? Well,
there are 52, maybe 53 different types of diseases or conditions that can cause dementia. Chuck had mentioned, urinary tract infections. People don't tend to think about that. Women in particular oftentimes have them during the course of their lifetime. As we age, men are also capable of getting the UTIs, if you will, and that can cause a dementia. But that's reversible, and if you keep people having good fluid intake, good personal hygiene, you're going to cut down on that sort of thing. There are any number of different types of dementias that are out there, and probably the most prevalent one, by the way, is over-medication or drug interactions that are counterproductive. I have a friend who's a geropsychiatrist and runs a mental health clinic, mostly assessing folks with dementia. One of the first things he does is take them off of all of their medications. And he finds anywhere from 60 to 70% of those people have significant improvement in their dementia because they've just gotten rid of all of those drugs that are interacting. Alzheimer's, is one type of dementia. But it is important to know whether it is Alzheimer's or something else, because there are other conditions that, if you treated them like it was Alzheimer's, it wouldn't work. You would not have success in redirecting. There are some types of dementias you're not going to get people to be redirected. You're going to just have to deal with them where they're at. They may sit and read the same book over and over again every day for the rest of their life, and you're not going to have any success. On the other hand, with Alzheimer's, there are things you can do with people that you can do to enhance their life and bring them out, if you will, a little bit. So it is really important to know the distinction, and know whether or not specifically someone truly has Alzheimer's as opposed to one of these other conditions, especially if some of the other conditions are treatable and reversible.
Thank you. Chuck, I've got several questions here about a variety of behaviors. Not brushing their teeth, biting a toothbrush, chewing on the bed covers, just a variety of those kinds of questions. Do you have any advice for how to deal with someone who's providing the care for the Alzheimer's patient when they have the more behaviors, and I've got another one that is hallucinating.
Sure. I mean, the biggest opportunity is to establish a routine. The most challenging thing with an Alzheimer's patient is unfamiliarity or lack of familiarity with what went on 30 minutes ago. So trying to get some semblance of normalcy of daily routine into the patient, starting with when they get up in the morning to when they brush their teeth, when they eat their meals, take care of personal hygiene, toileting, and so on. And you will establish a routine, and while, depending on the state of the patient, they may not remember that they brushed their teeth in the morning, the whole idea of being able to stick to a routine is establishing consistency and patterns of behavior. When there is a situation of chewing on the sheets or chewing on the toothbrush or chewing on whatever it might be, the best advice is that there's risk of harming themselves or perhaps running into a personal hygiene situation. Find and I hate to minimize this, but if we think of a 1-year-old that has a toy that they play with that they also use to tease on, having a toy like that's able to be kept clean and sanitized and be able to give them an alternative, because it's a natural response to want to chew on something or do a behavior. So let them do it, but just do it in a safe way or a more productive way.
Rick, I've got several questions too that deal with. One is, please go into the different stages of Alzheimer's a little deeper, and the other has to do with age, and a question specifically about early onset Alzheimer's, and another question about how old can someone be and have dementia and not Alzheimer's.
The answer to the last question is almost any age, and that does not necessarily mean old. As a gerontologist, somebody who's been dealing with aging issues when I was young, and now I'm beginning to be old and understanding them better, the fact of the matter is we tend to obsess about chronological age. We say, well, you look pretty good for 70, and I say, what does 70 look like? There is no characteristic. When you're younger, yeah, that people may be very similar at a certain age, but we know, that there are people at age 70 who are literally hardly breathing, and then there are people at age 70 who are still flying 747 jets, and not in our country, but in other countries. So the reality is, there's big differences in terms of age. Yes, you can develop. Most people would argue, and the Alzheimer's Association supports this, that yeah, most of us by the time we get maybe into our 80s, whatever that means, might have some degree of dementia. But the fact of the matter is, you're going to have some memory loss that's probably going to start for most of us in our 30s. So that's just a reality. But it's when it becomes significant, when you see personality changes, when you see that it's really impacting the family and how this person functions, that it becomes very, very significant. So at any age it can happen. I think the youngest person who's diagnosed with Alzheimer's, a trivia question, was actually 18 years of age. Very, very, very unusual, but nonetheless, it's the case. In terms of the stages of Alzheimer's, again, I think the first stage that I talked about, like the forgetfulness, the biggest thing there is to just differentiate between normal aging and the forgetfulness. When we all have these characteristics of forgetting the senior moments and all of that kind of stuff. Sometimes we call it mental clutter. Why is it that it takes a little longer to remember something? Well, sometimes it's because we've just lived longer. We've got a lot more stuff in our head, and it takes a while. It's kind of like finding something in the back of the file cabinet. It takes a little bit longer. So that can happen, but with stage 1, people are forgetful, and when you notice that, you recognize that they tend to blame other people. That's one of the big characteristics. They don't take it on, oh yeah, that was stupid, I forgot that guy's name. They'll say, that's not his name, he lied to me. That's when you see a personality change and when you see that aggressiveness. The confused stage, along the way is truly when someone becomes significantly disoriented. Stage 1, you can still function. Some people still function on the job, and I don't mean this without getting into politics, but many have argued that the last term that Ronald Reagan was president, it was quite possible that he had stage 1 of Alzheimer's. But with proper cueing and so forth, obviously he succeeded, and no one was aware of it. So that can happen. But when you get to stage 2, things are much more confused. They don't know night from day very often. They do have the sundowning behavior where things tend to get worse at night. We don't know why, but in the afternoon, things tend to. It could be fatigue. It could be a lot of things. But they truly are confused, and that's when it becomes very difficult for family because they may not recognize you. They don't know who it is, or they'll there's a commercial on TV where Grandpa comes up and he uses the wrong name for the granddaughter, and the granddaughter's upset. That can be very, very challenging. This third stage or the final stages really can be, for some folks, some very significant behaviors. If they have not passed away by that point in time, they may well have some significant behaviors. It could be aggressive. It could be, in some cases, the hypersexuality, although that happens sometimes in the second stage too. But they even moaning and groaning and not eating and all of that, and it's very, very difficult. And at that point, in some cases, some people do choose to have someone be put in a facility for better care. But the biggest thing I would stress is not everyone goes through this in the same fashion. You have to just monitor what's going on with your loved one.
I have some questions. Thank you, Rick. Chuck, I have some questions about resources. One is the bracelets that someone can use to detect location or wandering, and some of the other resources. Are there resources available for early for the first stages of Alzheimer's, and then some other ones? So would you go over some of those resources again, please?
Sure. Certainly we mentioned that the Alzheimer's organization or Alzheimer's Association is one of the greatest resources. They can direct you to a wide range of other organizations that specialize in Alzheimer's care and dementia care. From a safety standpoint, one of the things that you can do is bring in a handyman service to perhaps disable the gas stove is a big thing that we see quite often, and just use the microwave oven, which is certainly a much lower risk appliance, using hot plates rather than the stovetop. Again, other things that we see quite often, and it's really heartbreaking, is the wandering that will sometime occur in stage 1 and early stage 2. Is the loved one will get out actually driving and get lost and have no idea where they're at and have to be escorted back home by the police, and because they've fortunately had identification on them. But in other cases, even wandering out in the middle of the night. So equipping, if your loved one is living with you, equipping doors and with sound alarms to go off to keep somebody from going out at night. Any handyman service can put those in for you. And on more high-tech side, there are a number of devices that are available today that use kind of the concept of the GPS on your phone or your Garmin out there that puts up a virtual fence around whatever radius that you want your loved one to ideally be contained in or stay in. And if they wander outside of that area, it'll actually send you a text message, an email, or phone you to say that your loved one has wandered outside their safe zone and some action perhaps needs to be taken. So there's a number of technologies that will allow your loved one to live independently for perhaps longer than what they might otherwise be able to do so, Marilee.
Yeah, and if I might just quickly add, also have a discussion, if appropriate, with the local police department, fire department, and it will vary from community to community. Some, I've done training with police departments, and it was quite enlightening to them because the officers didn't know the difference between someone with Alzheimer's or mentally ill or this or that. We could give some clarity to that. And depending upon your community, if it's a smaller town, whatever, you need to let everybody know, yes, Dad's got this. If you notice anything, if you see him out there, befriend him, be friendly with him, but contact me. That's the low-tech approach, but it may also be helpful.
Our time for this conference is up now, and we still have lots of unanswered questions. However, as I mentioned before, your questions will be answered. Some of them are very specific, and we will answer them to the best of our abilities. I might also suggest that you go to the website, privatedutyhomecare.org, which is the National Private Duty Home Care website, and see if there are agencies in your area that are members of the organization, because, as I said, many of them do have caregivers that are trained in dementia. We also have a comment card that will appear at the end of this webinar, so we would appreciate it if you would fill that out. And again, any question that you have asked, we will do our very best to answer it, and we certainly appreciate your attendance tonight. And Rick and Chuck, thank you so much. And I'd also like to thank the National Private Duty Association for sponsoring this conference. And thank you so much, everyone who attended. And we wish you the very best while you're providing care for your loved one with Alzheimer's disease.